and you can go ahead.
Hi, I'm Bruce Ellsweig. I'm the medical director for Sullivan County Public Health and a family doctor practicing at Crystal Run Healthcare. As you know, we're dealing with an incredibly difficult situation with the COVID-19, and it's a never-moving target, and both to diagnose, and there is no specific treatment at this time for it. We are endeavoring as a public health organization to provide the best possible testing at the best possible places for our citizens in Sullivan County. But as you all know, this is a very difficult situation with limited supplies for testing, limited personal protective equipment, and limited sites. We do have Catskill Regional Hospital as a site for testing. We have Crystal Run Healthcare, which is now accepting non-Crystal Run patients for testing. And we have Hudson River Health Center, which is also testing people who are not their patients. We are struggling to get approval for an alternative test site as well. We realize that access to testing is a critical issue across our county since we are so widely and sparsely populated, and access is always an issue for any testing. We're also limited as far as the ability to test based on the criteria that are set forth by the State Department of Health and the CDC as far as testing only when symptoms are present. In the perfect world, we would have testing available to everyone, so we would know who are the asymptomatic carriers and who have recovered completely from the virus, so that we have a resource to gather information and to provide a resource for developing treatments for the disease. The antibody testing, which has been touted as the next step in providing diagnostic information, is unfortunately not widely available at this time. And although the door was open for developing these testing materials, the products that were developed are so far not entirely adequate. So we are limited as far as access to the antibody testing. We're still limited to those testing materials that are provided by the nasopharyngeal swabs, and the turnaround time, fortunately, has improved since our local resources now can provide the testing and do the testing in their own laboratories, so that we're not strapped as we were weeks ago with a 7 to 10 and sometimes 14-day turnover for the results of the testing. Again, we're dealing with a moving target. We in Sullivan County have experienced increasing incidences of the disease and unfortunately increasing deaths associated with the disease. We are fortunate in that we are practicing social distancing, and hopefully all of our citizens are providing themselves with appropriate masks, whether they're cloth masks made at home or masks that they can purchase. And they are using appropriate hand washing for 20 seconds when they wash their hands, and as a secondary measure, using hand sanitizer. The hand washing is the best way of doing this. Limiting your social contacts is critically important, and staying at home is vital. This is really the only tool that we have in flattening the curve, which, as it seems, is being done in critical places such as New York City and other places in our state, as well as in the country. This hopefully will lower the incidence of the active infections at this time and allow time to develop the appropriate treatments and vaccines for the disease. Unfortunately, vaccine production and testing takes time. I understand that the human testing has begun with certain vaccine products at this time, but they're not ready for prime time at this time. And I would suggest it'll be months or even up to a year before we can have adequate and safe vaccinations for the disease itself. We're doing a full court press in our county to protect our citizens. We understand that there is disparity in the presentation of the disease based on access, as well as what seems to be a racial preponderance of the disease. This is multifactorial. and as yet not totally explained. Proximity, access to healthcare, all of these factors, finances, transportation, all of these play roles in the access to the testing and appropriate treatment. We hope that people who have the typical symptoms of fever, cough, respiratory distress, sometimes the loss of taste or smell, will seek the appropriate attention for the testing and have the ability to access testing in their neighborhoods or in their communities. And we are, as a community health organization, public health is working very hard to make sure that the access is adequate for our citizens. Do you have any questions for me, Dan?
No, I think you answered everything I was looking for. I think the only question I think you answered it was who should seek testing, because everybody wants to be tested basically. But at this point, my understanding is people who are exhibiting symptoms and are in a high risk category are the ones that are being tested. Or has that changed? Is it getting better, more available testing?
We're still limited as to testing and the appropriate PPE for those people who are doing the testing. And you're correct in saying that it is at this time symptom-based. It would be a perfect world if we could test all contacts who are not symptomatic. And even the widespread testing of community members who want to be tested would be nice, but this was a promise that was made and can't be kept because we don't have the materials to do it. So we are limited as to the recommendation by the CDC and the State Department of Health as far as testing those people who present with symptoms and making sure those people are cared for well and making sure that they're quarantined, because quarantine is the best way to prevent spread. And also we are utilizing our personnel to reach out to the potential contacts who were exposed to those people who were diagnosed with COVID-19 so that as they develop symptoms, they can be appropriately tested. Again, in the perfect world, anyone who had a contact with a person who was diagnosed with COVID would be tested, but we don't have the resources to do that. And it would be my prayer that we would get that as soon as possible, but I don't think that's forthcoming in the immediate future. The resources just aren't there. And we look to the state to help us. The state is overwhelmed, and we have the government of our state has been right in the forefront of being aggressive to both treat the disease, to make available appropriate materials, and to advocate for all of us to get the necessary medical equipment to treat those people who are critically ill. So our state has really been doing a terrific job. We need more, and we need it today, but we will be as patient as we can be in order to treat the people that we serve in our county.
In the meantime, what do you recommend people who are asymptomatic but wondering if they might have COVID? What should they do?
Stay at home, take your temperature, watch for symptoms, avoid contact with other people, use your mask, wash your hands, and just be prepared. Be vigilant, keep your distance from people that you may be need to be close to at the supermarket. Using that 6-foot distance may not be perfect, but it's better than any kind of close contact. And the supermarkets that I've been in when I've had to go out and get groceries for myself or my mother, who is going to be 93 next week, have been really working very hard to keep distance between their customers so that the risk of spread is minimized. And even the cashiers have barriers. They are wearing masks and gloves. So I think that our community is doing a fairly good job in allowing access to getting the necessary supplies that people need, as well as protecting those customers who come into the stores. The other thing that's really important is that we need to be attentive to our neighbors who may not have access to food. We need to care for those people who don't have the resources to get their food and the items necessary to sustain their well-being at home. So if you have a neighbor who may not be able to get out, think of them, call them, be sensitive to the fact that social isolation also can lead to depression and other emotional issues. And if you know a neighbor that hasn't gotten out, give them a call. Be sensitive to the people around you as far as your exposure and their exposure to you, and just be careful, be aware of the community as a whole.
All right. Thank you, Dr. Ellswick, for joining us. I appreciate it.
My pleasure, and you have a great day, and please stay well. Be careful.